So we are going into chapter 14, and it's a fairly straightforward chapter, but it does focus on communication and some of the things that are really going to be essential when you get to the floor. And so one of the main topics that I want to focus on for chapter 14 is on the idea of report. With report, this is something that you will take every time that you are on the unit. In terms of legal responsibility, if you will, we always say that you are responsible for your patient population once you've received report. And it's kind of the transitioning of the responsibility from one CNA to the other. So for the CNA who is leaving, they give you a report when you come on to your shift to tell you what types of things happened. They're going to give you some objective and subjective data, where subjective is the things that the resident maybe told them, and then objective is those things that are measurable or more concrete, if you will. And you just want to make sure that you are aware of what's going on with all of your residents. Some important questions that you can ask would be, is anyone in isolation? And is anyone out to the hospital? Is there anyone that has special restrictions or special guidelines that I need to follow? If you're new to that area, maybe asking, are there any residents that need to use the Hoyer lift or the stand-up lift when they transfer? These are important things that you want to ask to make sure that you have the right information before you go to the floor. Other things to consider would be the residents' bowel movements and their bowel habits, and then maybe if they're having any issues with eating or elimination. And so asking those questions of the CNA who's given you a report will help you to have a better experience once you take over the floor. And then remembering that once you take report, you are now responsible for the residents that are assigned to your section. The other thing that chapter 14 is covering is the documentation of what you're seeing on the floor. And every clinical facility uses different methods of documentation. So there's 4 different types that are covered in your book, 3 different types. The first would be flow sheets or checklists. The next would be progress notes, and then lastly, computerized charting. And I will tell you that most clinical sites have moved to computerized charting. And when you're at clinical, you really want to make sure that if they are doing computerized charting and maybe a system like Point-Click Care, you want to make sure that you get to see that while you're at the clinical experience. The flow sheets you will see more so maybe in a home health environment. This is like a checklist that you would do that says, yes, I gave them a bath. Yes, I got them dressed. Yes, I brushed their teeth and provided oral care. This checklist is fairly quick to complete, but they would expect for you to complete it on every resident, every shift. And then lastly is progress notes or narratives. These are a little bit more detailed in that you have to actually write out a paragraph statement about what you saw, what you did, what issues you may have had with the resident, and you're going to write that narrative in a way that other practitioners or other CNAs, would be able to read it. And so your progress notes are a little bit more detailed, a little bit lengthy. They don't kind of expedite the charting process, but they are very useful when written well. And so take your time to write your narrative so that other CNAs and the nurses are able to follow it.